So friends, see this diagram. So you can see that on the left side the person is female, which has the karyotype of XX, and the person has the normal ovaries and uterus, and the person is phenotypically female and also genetically female. So this is about the left side. Now on the right side you can see that the person has a karyotype of XY, but the person has like a female type appearance, so the person is phenotypically female. And also you can notice that on the right side of the person the ovaries and uterus are not developed. So now I am going to explain why in the patients of androgen insensitivity syndrome ovaries and uterus are not developed, though the patients are phenotypically female. Now, so for knowing this, you should know a little bit about the intrauterine life. So see that, so this is the condition of the fetus on the 5th week of intrauterine life. So, and also you can see that on the 5th week of intrauterine life the fetus has two ducts, Wolffian ducts and the Mullerian ducts. And you can note that from these Wolffian ducts in future, that is male reproductive organs will develop, like testes, scrotum, penis, all these things. And from this Mullerian ducts in future, uterus, ovaries, fallopian tubes and cervix will develop. So this is the condition of the fetus up to the 5th week of intrauterine life. Now on the 6th week of intrauterine life, that this Y chromosome is activated, and this activated Y chromosome releases SRY gene, and due to the presence of this SRY gene there is Wolffian ducts are activated, and also that is testes formation are done. So simply remember that on the 6th week of intrauterine life there is Y chromosome is activated, and this Y chromosome leads to formation of testes. And you should know that these testes which are developed from Wolffian ducts, and these testes lead to development of the further male reproductive organs. And also you should know that these testes, so here release Mullerian inhibiting ducts, and due to the release of this Mullerian inhibiting ducts, all the parts which develop from Mullerian ducts like ovaries, uterus, fallopian tubes and cervix, all these parts regress. Why? Because that this Mullerian ducts regress. And why Mullerian ducts regress? Because the testes which are formed due to activation of Y chromosome, and this testes releases Mullerian inhibiting drugs. So in a normal male on the 6th week of intrauterine life, that this Y chromosome is activated and these testes are formed, and these testes release Mullerian inhibiting ducts, and due to the presence of this Mullerian inhibiting ducts in such normal males, no uterus, ovaries, fallopian tubes and cervix develop. So this is a normal situation. But in the patients of androgen insensitivity syndrome, as you already know that undescended testes are found. Now, and you should know that these undescended testes also release Mullerian inhibiting factors or Mullerian inhibiting drugs. Simply remember that these undescended testes also release factors that inhibit Mullerian ducts. So due to the presence of these Mullerian inhibiting factors in the patient's androgen insensitivity syndrome, that this Mullerian ducts regress. So at a regression of this Mullerian ducts, no uterus and ovaries and fallopian tubes develop. So simply my summary is there, that in the patients of androgen insensitivity syndrome, undescended testes are there, and these undescended testes, so here release Mullerian inhibiting factors, and due to this Mullerian inhibiting factors, ovaries and uterus don't develop. So this is the main reason. So friends, so now about the ovaries and uterus. So see that while ovaries and uterus underdevelop or not develop in the patients of AIS, that is androgen insensitivity syndrome. See that, so as you already know that undescended testes found in such patients, and these undescended testes release, that is androgens, and these androgens are the male hormones, and out of this, that is the testosterone is secreted in the highest hormone, that is 90 percent of that is androgen is constituted by this testosterone. And here you should know that this androgen, so here releases MIF, that is Mullerian inhibiting factors, and due to Mullerian inhibiting factors regression of Mullerian ducts done, and due to which that is ovaries and uterus not developed as they develop from these Mullerian ducts.